Hello and welcome to the International Transport Forum's Ask the Author session on the health impacts of low carbon transport in cities, evidence for better policies. In this 30-minute session, we'll hear from our lead author who will bring us through the latest report with the issue, methodology, and the main findings. And then it's your chance to ask the questions using the Q&A function in your Zoom window. If you're joining us on YouTube or LinkedIn, and you'd like to ask us a question, please use your link in the event. You can join the Zoom webinar and then ask us your questions. So if you already have a question, don't hesitate to put it into the Q&A function. We'll get to as many as we can following the presentation. We're delighted to have Vatsalya Sohu with us, the lead author of the report. This is a corporate partnership board report launched just last week and looks at the links between low carbon policies, the health impacts, and the potential cost savings under certain scenarios. And often a very overlooked area. The idea of this is to raise the profile and have health front and center of future transport policies for everyone's benefits. I'll post a link into the chat window with the report. And in the meantime, without further ado, Vatsalya, over to you for a presentation of the main findings.
Thank you so much, Ronan. A very good afternoon to everyone joining. My name is Vatsalya Sohu. I'm a policy analyst at the International Transport Forum. As Ronan just mentioned, I will be briefly presenting to you our recent work on health impacts of low carbon transport in cities, evidence for better policies. And as the name suggests, the project assesses the impact of transport decarbonization measures on health outcomes in cities. I will walk over some of the key findings of the recommendations of the project, and then leave you with some of the key messages that we really want to drive home. Before I dive into it, I would like to take a moment to thank my colleagues Pauline Baudins and Mallory Trouvé, who were instrumental to the project and to the completion of this report. And I also thank all the experts who we've interacted with around the globe whose exceptional contributions have enriched this report. A bit of a background on why we did this project. The aim was to acknowledge and cement the idea that successful decarbonization efforts must reduce carbon emissions and at the same time prioritize urban residents' health and overall quality of life. These outcomes must be planned for together and not as solitary, disconnected goals. In this report, we focus on passenger transport in cities and on how introducing low carbon transport can improve the health of urban residents. Currently, there's a reliance on motorized transport based on internal combustion engines, and that continues to generate soaring amounts of greenhouse gas emissions and undermines the efforts to combat climate change. We also know that urban mobility systems dominated by private vehicles also lead to sedentary lifestyles, contributing to the rise of non-communicable diseases like diabetes, chronic kidney disease, chronic obstructive pulmonary disease, and heart diseases. Given this context, we know how interconnected transport, climate, and health outcomes are, especially in cities. And through this project, we evaluate how exactly can ambitious low-carbon transport impact health positively and in a cost-effective manner. Transport policy contributes to healthier urban environments by increasing physical activity or reducing air and noise pollution, directly or indirectly. Measures like expanding bicycle and pedestrian networks, optimizing public transport, managing speed, developing shared mobility options, encourage more active lifestyles and lead to better physical health and reduced risk of chronic diseases. There's also other measures like vehicle restriction schemes, slow speed zones, land use policies that can decrease the reliance on cars and cutting down emissions that contribute to respiratory disorders. And in this report, we present several transport decarbonization measures that impact health positively. We go into great detail on these measures in the report, and while I won't go into the details of these measures today, some of the measures are on your screens. You can see they're divided in different categories and all of these measures reduce emissions and increase physical activity, which in turn positively impacts health outcomes. So how we evaluated the impact of low carbon transport on health was through a joint modeling exercise using the ITF Global Urban Passenger Model and the OECD Strategic Public Health Planning Model. Now, traditional transport models have primarily focused on predicting traffic flows and infrastructure needs based on socioeconomic and demographic factors. However, these models often overlook important health outcomes, such as the effects of increased physical activity and the reduced air pollution on public well being. So, by combining the two models, the ITF Global Urban Passenger Model and the OECD Strategic Public Health Planning Model, we want to present, and that's what we've done in the study, we present a more comprehensive approach to urban mobility. Now, the ITF Global Urban Passenger Model estimates travel demand, including increase in physical activity and the related emissions up to 2050. The pollutants that we account for include carbon dioxide, carbon monoxide, nitrogen oxide, particulate matter, to name a few. And these are calculated for 18 different transport modes. Now, in this report, we look at two policy scenarios that are based on the ITF Transport Outlook 2023. So the two scenarios are the current ambition scenario and the high ambition scenario. The current ambition scenario, which you will see marked as CA in the next slides, would provide insights into how transport sector demand and emissions would evolve if the current policies that are already in place were to be followed, while the high ambition scenario presents the impact of adopting more ambitious transport decarbonization policies in the future. So what we do is we take the results of the ITF transport modeling exercise, the results specifically of changes in physical activity and emissions, and feed those into the OECD Strategic Public Health Planning Model. And that model calculates the impact of these changes on health indicators like life saved, the evolution of the occurrence of chronic diseases, but also productivity and the impact on public health spending. And these are some of the main outcomes I would like to focus on in today's presentation, how the high impacts health outcomes and reduces the costs to the economy. So starting with the evolution of local pollutants, we can see here that pollutants are significantly decreasing in high-income countries for both current ambition and high ambition scenarios, and under the high ambition scenario, also decreasing for middle-income countries. However, here, as you'll see, despite decreasing for both current ambition and high ambition scenarios, they remain significantly above the 2019 levels for PM 2.5 in low-income countries. And this can be attributed to the use of second-hand vehicles and also the lower technological improvement rate for vehicles in these countries specifically. Moving on, if we look at the active mobility demand, the total passenger kilometers for all regions is higher in the high ambition scenario than in the current ambition scenario in 2050, except for in China. And this could be driven by stronger densification measures and significant promotion of public transport infrastructure services in China. And we also know that walking always has a lower level of passenger kilometer in the high ambition scenario than in the current ambition scenario. And the total increase in physical activity generally comes from a higher cycling level. This is a result of shift from predominantly urban sprawl-driven growth under the current ambition scenario to one that is driven by promotion of active mobility through very adapted policies and well-designed infrastructure under the high ambition scenario. Just to also make sure that everyone understands, you'll see the regions China, Europe, India, which are self-explanatory. LAC is Latin America and the Caribbean. And UCAN plus JK would be United States, Canada, Japan, and Korea. Now, moving on to the impact on health outcomes, we estimate that about 13 trillion life years could be saved in the urban areas of all the study countries between 2022 and 2050. Um, the highest positive impact, as you can see on your screens, is expected in China, Europe, and United States, Canada, Japan, and Korea, where urban air quality is expected to strongly improve. Putting this into perspective, this 13 trillion figure life years would be approximately 4.5 billion centenarians per year, which is roughly equivalent to the combined population of China, India, European Union, and the United States living to 100 years old annually. Then when we look at disability adjusted life years, DALYs, where life years are discounted when an individual suffers from chronic disease, the impact is even stronger. In total, we save about 21.5 trillion DALYs, which not only is an increase in the lifespan, but also significant improvements in quality of life, reducing the years that people would otherwise live with chronic illnesses or disabilities. And it is worth noting that these results likely undermine the total years of life saved, as in the modeling exercise that we conducted, we only looked at passenger transport, but these measures, when put in place, would also reduce emissions from freight transport, which means the impact would be even higher of these measures. Now, coming to non-communicable diseases, these diseases account for about 74% of global deaths, with 77% occurring in low and middle income countries, where cardiovascular diseases, chronic respiratory illnesses, and cancers are most prevalent, according to the WHO. And the occurrence of these illnesses can be reduced by up to 10% in the high ambition scenario. Improvements, albeit lower levels, are also observed for mental health and physical activity, and sometimes the occurrence is increasing, as you will see, by 0.1 or 0.2%. This is likely due to the longer life expectancy enabled by the increase in years of life, which also increases for the older population, the number that are affected by dementia in later years of life. Now, to understand how these health benefits impact productivity, we look at the yearly productivity gains. And this happens because of improvement in well-being that enhances physical capacity, resilience to stress, reduces the likelihood of various diseases, in turn boosting motivation. And these factors influence productivity in terms of the availability of workers, reduced absenteeism, and reduced presenteeism, which is being at work with reduced productivity. And when we convert this added workforce capacity into economic value, the projected yearly gains amount to a total of 22 billion US dollars, which is comparable to the entire economic burden of air pollution related premature deaths in a city like New Delhi. And finally, we can show that this approach is not just good for the environment, good for positive health impacts, but is also cost effective. Earlier, we saw that there will be a decline in costly diseases for the society. Therefore, a positive impact leading to savings in healthcare expenditure is expected under the high ambition scenario. In total, about 875 billion US dollars could be saved annually in the study regions, with the largest savings expected where health improvements are most pronounced. As you can see on your screens, this would be China, Europe, and again, US, Canada, Japan, and South Korea. And to understand this example, the combined figure of 875 billion, this figure combined could represent the total healthcare budget for several large economies today. Now, this brings us to our top recommendations from this work, and I'll start clockwise from the top left. Health metrics must be integrated into planning and decision-making processes. Using health outcomes as a benchmark for project success in transport and urban policy can have really positive health impacts. It can help prevent diseases, reduce healthcare costs, and improve the overall quality of life of urban populations. Secondly, governments should significantly invest in safe, comfortable, accessible infrastructure for walking and cycling and other forms of active transport, while at the same time also improve and expanding public transport services. Next, Equity must be a cornerstone of urban transport planning. It is critical to ensure that all citizens benefit from air quality improvements and measures that help improve health outcomes. Citizen participation in urban planning should be inclusive and representative, considering the needs of all socioeconomic groups. And finally, there is a need for collaboration between health, environment, transport, and urban planning sectors. Um, and more than that, involving research institutions and academia in these planning exercises can make sure that the policy decisions are rooted in evidence-based insights. And finally, if there are three messages that we want to drive home, it would be these that low carbon mobility is cost effective and healthy. It not only reduces greenhouse gas emissions and improves health outcomes, but it's also bringing cost savings to the economy. Next, the urgent need for integrated cross-sectoral policies. Coordinated actions can achieve better health outcomes while meeting climate targets. And finally, equity and inclusion cannot be an afterthought for healthy mobility planning. Vulnerable groups, older adults, low income households often experience higher exposure to urban health risks, as well as barriers to mobility. And addressing these disparities is crucial to creating cities that are healthy, inclusive, livable, and low carbon. And that brings us to the end of this presentation. Thank you very much for your attention, and I hope you found it interesting. I'm very happy to get to know your thoughts and answer any questions you may have. Thank you.
Thank you very much, Vatsalya. Very interesting indeed. Now the floor is open to our participants. Please use the Q&A, the question and answer function in your Zoom window to send us your questions, which will help us to moderate and get through as many as possible. The first question, Vatsalya, is looking on what looks like a very obvious link between the policy and the potential benefits. Why is there this certain disconnect between health and transport objectives, and what sort of policies, what cross-sectoral policies could be put in place to bridge that gap?
Sorry. Thank you. Thank you for that question, Ronan. It's an important question. And cross-sectoral policies could include several things. Just a few examples that we've touched upon in the report include things like health impact assessments for urban transport projects, integrated urban planning that considers public health outcomes, and also exploring governance structures like something like a position that is, let's say, a healthy city manager that bridges the gap between transport, health, and urban planning. Such policies, I think, would foster coordination between stakeholders to simultaneously address climate as well as health targets, so that there's no disconnect between the different priorities, let's say, of these different sectors within a city.
Thanks very much indeed. Again, please use the Q&A to send us in your questions. The next question, well, I will jump to a question on the actual, I think it's about the methodology and the specifications of the modeling. The question wonders, how does the report account for the potential negative impacts, such as increased exposure or air pollution for people using active mobility, for walkers and cyclists? Is that part of the methodology, and how does one account for the difference between those users compared to motorists, for example?
Thank you. That's a really important question and something we do acknowledge in the report. So it is true that active mobility users, people who are on their bikes, pedestrians, will be exposed to air pollution more than other commuters. And while this exposure can partially offset the potential health benefits, in the long term, we expect that greater physical activity generally outweighs these risks. And while in the modeling exercise, we are not able to account for this offsetting, we do acknowledge it in the report that these could be potentially offsetting the health benefits. And there are plans for our future modeling efforts to sort of include this nuance and present the results more comprehensively so that we are able to not neglect, let's say, these little nuances. That said, yeah, it's not something we have been able to do in the modeling exercise for this report, but we acknowledge it, and it is an important aspect, and hopefully in the next exercise we're able to include it.
Okay, thank you. So stay tuned for more. The next question in from Nanuel Morandi, who asks, what is the most cost-effective measure to reduce local air pollution from transport? That may be depend on the jurisdiction, Vatsalya.
Yeah. So I think it depends really on where you're talking about. As I wasn't able to go into the nuances of different regions in the presentation, but in the report we touch upon what could be the different kind of measures used in different contexts, in different regions, in different countries, and some of the measures that can be low cost are things like tactical urbanism measures, such as temporary bike lanes or pedestrian zones that are quite cost effective as solutions to start with. And at the same time, I think partnering with local communities and spreading awareness about the positive health impacts ensures that they are actually adopted, and there is interest for maintaining these measures and making them more permanent going forward.
Thanks very much, Vatsalya. A reminder to use the Q&A function to send us your questions. We still have time for a few more. The next question is on the non-exhaust emissions that are part of a limitation of electric vehicles. Should cities address this challenge? Should it be regardless of the type of powertrain? And I guess this is about local pollutants, tire pollution, etc. Can you speak to that, Vatsalya?
Thank you, Ronan. That's indeed a very important point. And again, it is something we touch upon in the report. Cities can indeed take measures to address these non-exhaust emissions. And that is already something that we talk about. That's basically promoting active mobility, improving public transport services and infrastructure, as an alternative to private vehicles, regardless of the powertrain, right? Because that's what we're aiming for, to have more people commuting by active transport and public transport instead of private vehicles, whether or not they are electric vehicles. And additionally, as we move towards developing lightweight materials for EVs and improving braking and tire technologies, enhanced road maintenance also can help reduce these non-exhaust emissions that I think the question refers to. And it is true that indeed these measures need to be more integrated into urban transport policies. But to start with, I think the right way would be to promote active transport and public transport as an alternative to private vehicles, no matter what the powertrain is.
Thanks very much, Vatsalya. A question on titled Build Back Better. In the post-COVID paradigm, did we see a change from the increase in active mobility linked to COVID? And I'm thinking that this is about bike and walking lanes specifically. Has that been the beginning of a transformation towards integrating health into transport policies? Or is it business as usual? Reading between the lines.
Thank you for that question again. It is something that we've come across a lot in the discussions that we've held for this report in the workshop. And to some extent, it is indeed true that COVID sort of started the promotion of active mobility in a way that we had not seen before in several cities, where there were temporary bike lanes set up to enable people to commute. And in many cities, if not all, we know that a lot of this infrastructure has been converted into permanent infrastructure, and that that start that COVID sort of was a reason for has become a more permanent agenda item for cities and transport authorities to continue building upon. I think there are several cities that are a good example, and for me, I live in the city, so I could say that Paris definitely is one of those cities that started a lot that started taking a lot of measures during COVID to promote active mobility and has continued and has made those changes more permanent to really embed those changes in long-term policy. And I think that is a good way to go about it. If there are cities who have started this during COVID and started this as a way of improving mobility during those times, it is good to keep that momentum on and to continue building on those measures that were taken.
Sorry, thanks, Vatsalya. And the next question is in from Alex Genoux-Prachez, who thanks you for the presentation and wonders, do we plan on a type of report that focuses on the logistic or transport of goods aspect in cities, I presume with the health aspect as well? This is covered somewhat within this report, right, Vatsalya?
Thank you for the question and thank you for your kind words. We have only focused on passenger transport in this report, and that's the reason for that is just the way our models are articulated right now. We focused on the ITF Global Urban Passenger Model, which looks at, as the name suggests, passenger transport in urban areas. For now, this modeling exercise does not include any logistics and freight transport. But of course, the measures that we look at, if not all, most are transferable to also freight and logistics sector and would very much add to the health benefits if quantified. While we were not able to do that in this report, it would be something that we would be very interested in carrying out because there was also a lot of interest from our partners as well in this sort of a study that looks not just at passenger but also the freight and logistics sector to understand the total sort of benefits that would come about if these measures are put in place in cities. So it's not something we have done in this report, but it's certainly something that's very interesting to the ITF, and hopefully we can have something that looks at freight as well.
Thanks, Natalia, and I'll send links later for how you can stay up to date with our latest publications. A quick poll for you to answer to let us know whether you find these sessions useful and help to guide us. There's time for one or two more questions. A question in from a great friend of ITF, Maliti Fernando. Hello, Maliti. Maliti says that in your research, you found that cities have been more successful in implementing sustainable transport measures when they are framed as measures to improve health or safety versus climate change. Now that climate change has become a contentious topic in some political contexts, how can reframing these issues as a health issues help promote public support for these issues to move the argument away from a climate argument towards a health argument for low carbon transport? Is that a way forward?
Thank you, Maliti, and hi. Thank you for the good question. It's a very interesting question, and I have a really good answer for it. And that would be, yes, unfortunately, I think if you cannot sell healthy, low carbon transport through climate, I think the next best thing would be health, given the enormous health benefits that we've showcased it brings, but also combining that with not just the positive health outcomes, but also the financial savings. And I think that's a big argument for a lot of cities and for policymakers to back up anything if it's financially feasible, and not just feasible, if it's financially beneficial. I think that's something that helps policymakers put forward measures and back those measures up in a lot more in a much stronger way. So if climate is not something that would pass as a reason, I think it should be health, and health along with the cost effectiveness and the gains that it brings to the economy in terms of public health savings, but also increased productivity, increased workforce. Yeah.
And as in your presentation, in the report, you can find more empirical evidence based on the modeling. Again, this is the first time these models have been applied to a health context with the aim of improving that aspect of policies. One last question. You mentioned that the World Health Organization, the WHO, if you look at the flip side, from the WHO, are they also promoting transport policies that would have an impact on health? Is that something that other organizations are now aware of?
Definitely. I think there are a lot of organizations like the World Health Organization who we did interact with actually during the course of this project, initially for the scoping, for the workshop as well. And there are a lot of organizations, a lot of cities that are promoting low carbon transport for health, for positive health outcomes. And there is a wealth of research and literature that's available for anyone who's interested in the topic. Um, in fact, there are also cities that are conducting actually health impact assessments for transport planning. Cities like Copenhagen and Portland in the US have been consistently doing this. Um, but yeah, it's not the first time that this is being talked about. Definitely, it's something that's on the agenda of many organizations working in similar fields. And there's a lot that you can find online if you look.
Great, thank you very much, Vatsalya. That is our time up in this 30-minute session. Thank you very much, Vatsalya, and also thank you for everything you've given and contributed to ITF over the years. Vatsalya is leaving us to our great regret tomorrow, but we're delighted that you're going on to brighter things, Vatsalya, so thank you very much.
Thank you, Ronan.
I'll just pop into the chat. There's 2 more Ask the Authors coming up tomorrow and next week. If you're interested, they're in the environmental and new mobility subject areas. Please sign up and join us if you'd like to ask more questions and Ask the Author. And there's a few links to stay in touch with us via our social media and newsletters. So thank you very much to all our participants. Thank you very much, Vatsalya, and we'll see you very